Hi, everyone. I hope everyone's doing well. And I hope that you were able to check out my video yesterday on the lymphatic system, the lymphatic lymph nodes of the face and neck. For today's video, I would like to explore some of the massage techniques that are used in lymphatic drainage massage for the face and neck. First of all, before I get started on stimulating the lymph nodes, I would like to note that the proper pressure for a lymphatic drainage massage is very light, only enough to gently stretch the skin without feeling the underlying muscles. The reason is the lymph nodes lay just below the surface of the skin, and in order to properly stimulate the lymph node, you have to really feel uh, and just really gently stretch and glide towards the lymph node, almost as if you're holding a nickel and just gliding the nickel over towards the lymph node. Also, deep pressure is ineffective for lymphatic drainage since the lymph nodes lies directly under the skin. So I was a little bit confused about the gua sha massage that are uh, everywhere on Instagram. And also some of the techniques that I learned through continuing education classes that I took. I think the gua sha is really more of a contouring and acupressure for the face rather than lymphatic drainage massage, unless you go very late. But I think the best way is to just use your fingers and use your intuition and just feel the skin and just gently glide, gently stretching the skin. And also, before you do anything, it's best to use some oil or lotion on the face so that it's easier to glide and you're not irritating the skin. First of all, I like to start with stretching of the neck. So just gently feel the neck and stretch, see where you have tension. Then you can roll your shoulders. Since the muscle is what really moves the lymph nodes in the body. So after you do some stretching, and also you can stimulate some of the major lymph nodes of the body, such as the armpit here. And you can go a little deeper in the armpit since the lymph nodes are also deep and they lay superficial. So it's okay to massage a little deeper here and the thoracic duct area. And here I like to just tap. Helps to stimulate the thyroid gland as well. And also you can use here this side to stimulate your groin where major lymph nodes also sit. After you stimulate the major lymph nodes of the body, you want to start with this point right here, which is the deep cervical lymph nodes of the neck. And it is right on stomach 12, the lateral border of SEM above the clavicle. And this point, you can also use this like that if it's hard to reach. You can go a little deeper because it's a deep lymph node. And I like to just use circular motion right here. And once you open this master lymph node for the face and neck, I call it master because all the lymph fluids from the superficial lymph node drain into this point eventually. So it's very important to open this point before and also after the lymphatic drainage massage to help to properly drain everything down. And then once you stimulate that, you can start stimulating the superficial lymph nodes of the face. First one is the occipital, which is behind your neck. And yesterday, if you saw my video, you know that this one helps to drain the lymph from the scalp occipital area. So you can also stimulate your head gently since the lymph nodes, the lymph fluids lay just below the skin here. And then you can just massage the back of your head and gently down to the occipital lymph node. The next one is the mastoid, which is right here. And generally, you want to glide towards the lymph node very lightly. And this one, if you remember yesterday, drains the lymph fluids from the superficial face and the temporal region. So you want to start here, here, temple area, and there is the preauricular lymph node. Very lightly. And you can go down all the way down to the master lymph node, stomach 12. Very slowly, and you can go even down to the thoracic duct area. You can stimulate gently, just like holding a nickel on your fingertips and gliding. You can tap this area too. All right, next one is we just did preauricular, so parotid. The parotid is the one that helps to really drain the sinuses. So we want to go from the nose to the parotid lymph node. And also you can use your whole hand. I like to use, actually stimulate my hand, create some chi, life force through my hands, and then you can glide very gently towards the parotid lymph node. And here, same thing. You can go down towards stomach 12. Okay, the next one is the submental, which is right here. And this one, if you remember, the lymph drains from the lower lip and apex of the tongue. And this one I actually just gently like to, press it a little hard. Feels good, but that's not the proper massage technique. So anyway, just lightly you can tap this area. You can do some Actually, the other way. Because you want to always go towards the lymph node, not away. All right. Next one is submandibular lymph nodes. So they're under the chin. And if you remember, they help to drain the lymph nodes from the cheeks. So you can actually do the same thing. Create some chi from your hands. And then gently from the cheeks down, you can glide down very slowly using your whole hand into the submandibular lymph node, and then you can just very slowly stimulate the lymph node here and then go down into stomach 12. The next one is facial. There's three. There's a infraorbital, which helps to drain fluids from the eye area. So this one I like to just do a little bit of a circular, very gentle circular massage to help to bring the fluids into this point here, infraorbital, and then also buccal. You can just gently stroke. And the supramandibular, which is on the chin, this right here, you can just tap it. If you remember yesterday's lecture, the facial lymph nodes are lymph nodes that help to drain the mucous membrane of the face. So it's a really good point for sinus congestion as well. So you can just do more outward, gently down to the buccal. And you can do down to the supraorbital. And then bring kind of everything down to the stomach 12, where everything drains. All right, so next one is the superficial cervical, which are anterior to the SEM on the right at the angle of the mandible. At this point, I like to just gently tap because a lot of times I think this point gets swollen for people, especially if we live in more of a stressful, toxic lifestyle. We could build up a lot of toxicity in this area. It could be very sensitive, so just gently stroke, and then you can bring it down to stomach 12. And then just tap it. All right. So that was basically, uh, I think, a general lymphatic drainage massage for the face and neck. The general idea is to really bring the fluids towards each facial lymph node. If you remember the video yesterday, I explained exactly how each lymph node helps to drain specific areas of the face and neck. So that's what you would follow in terms of how and which direction to go to, per se.